as you transition from patient to survivor, sometimes I see this is sort of a new growth phase and something breaking up through the dry earth, and it needs some protection and needs some care. And things you want to do is sort of maximize your overall health and well-being and be knowledgeable so that you're able to make good decisions about your future. And so some of the skills that we'll go through the course of the day in different ways will teach you how to be an information seeker, how to communicate with your peers, with your caregivers, and with your physicians and other healthcare providers, and how to tackle problems when they arise, and how to negotiate so that you get what you think you need. And so one of the most important things is really knowing your disease and knowing your treatment. And this is where programs like Passport for Care can come in and help you. You know, you need to know when you were diagnosed, what kind of cancer you had, what stage you were, and where you relapsed. And the most important thing is to have reports, because some people really know a lot of information, and then some people say, oh, well, I had lymphoma. And for my perspective, it's really helpful to know exactly what kind of lymphoma. And then at the same time, you need to know the kind of treatment, because some of the late effects you may develop will be based on the kind of treatment you received, the type, the dose, how it was given. Did you have chemotherapy, radiation therapy, a transplant? Was it an autologous transplant or an allogeneic transplant? And so there's several issues. Today I'm concentrating on the physical ones. Wendy will follow up on the emotional ones, and then we'll have some tips in some of the breakout sessions on some practical issues. So what are the physical issues? Many different systems through the body can be affected. Anywhere from your brain to your heart, your lungs, your liver, your kidneys, your hormones. Chemobrain is something a lot of young adult survivors talk about. Impaired cognitive functioning can come from radiation, but also from chemotherapy, and this can be chemotherapy that's given around the brain and spinal cords, which is intrathecal chemotherapy, which is mainly leukemia and lymphoma survivors, but also some brain tumor patients. But even some systemic chemotherapies given by mouth or through the IV can have effects on how your brain works. And some survivors will be at risk for developing strokes, and particularly those that had radiation to the head and neck. Cognitive impairment is a big word that means a lot of different things. It can affect handwriting. It can affect your ability to spell. How well you understand what you read, doing math problems. But not only that, day-to-day living things like being able to pay attention, being able to remember things, to plan and organize. And it can even affect some people's social skills and maturity level. Your eyes can be affected. Those that get radiation and take steroids for prolonged periods of time can develop cataracts. Decreased vision can occur to people that have tumors of the eye or near the eye, as well as certain kinds of chemotherapy, and again, radiation to the eyes or near the eyes. Hearing can be affected by several different medications you get, certain kinds of chemotherapies, some of the platinums, but also antibiotics and Lasix, which is a diuretic that can be given. We monitor these with audiograms, which are essentially hearing tests, and if necessary, you may need hearing aids. Hormones, there's a whole variety of things that can be affected. Your thyroid can be affected. If you have had thyroid cancer, obviously that will be affected. But radiation to the neck area can also decrease the activity of your thyroid gland. Some treatments can cause diabetes, both temporarily or permanently. Osteoporosis is a weakening of the bones. And there are ways to help rebuild up your bone, but that needs to be monitored. And then some patients, if they are still growing, when they're treated for cancer, may not grow as much as they would have. The heart can also be affected. The two main causes for problems with the heart are anthracyclines, sort of daunorubicin, doxorubicin, idarubicin, mitoxantrone are the big drugs. And that tends to occur later on in life, after 5, 10, 15 years. So we do recommend echocardiograms throughout your life, monitoring for that. People that had radiation to the chest area can develop early coronary artery disease, which is something that causes heart attacks. And it can also damage the valves in the heart. And again, echocardiograms will help with the valves, and then there are other tests to assess for coronary artery disease. The lungs, the main two causes of problems with the lungs are bleomycin, which can be used in certain kinds of lymphoma and in germ cell tumors. Particularly, one of the good examples of this was Lance Armstrong had a germ cell tumor, and he went around to find a doctor that could treat him without giving him bleomycin, because that would have potentially could have been a career-ending late effect for him. And radiation is the other cause of pulmonary fibrosis. We do pulmonary function tests for this, and there are treatments to control symptoms, but there's no real way to reverse the fibrosis. And then your kidneys, different chemotherapies and again antibiotics can cause decreases in kidney function. If you do develop problems with your kidneys, you can go on to develop hypertension, and if it continues to progress to renal failure, you could require dialysis. So this is one of the reasons we like to keep a close eye on the kidney function, so that we can minimize the progression and avoid other medications that can further damage the kidneys. Simple things like ibuprofen can cause problems with the kidneys. Your bones, avascular necrosis can be a problem, and some of our survivors today will talk about that. Primarily caused by corticosteroids and radiation. So this is primarily in leukemia patients, lymphoma patients, and transplant patients that develop graft-versus-host disease. Osteoporosis, or a weakening of the bones, has many different causes, but optimizing your nutrition and exercising can help to maintain good bone strength. And then one of the most serious late effects is the risk of developing another cancer. Certain chemotherapies that we give to treat the first cancer can cause acute myeloid leukemia. And then women who receive radiation to the chest area, particularly Hodgkin's disease patients, can go on to develop breast cancer. And then other solid tumors that are treated with radiation can develop secondary solid tumors within the field of radiation.